This is a young patient that's been experiencing bilateral knee pain for almost 5 years. He's been playing sports all his life. He's been going to the gym, very active, an athlete, and he's been suffering from knee pain for quite some time. So we did an MRI and it showed meniscal tear in both knees, plus patellar tendon is wearing out, which is the tendon that holds the kneecap in place, plus a little bit of arthritis in there. So we looked at all the options and we started with PRP, platelet-rich plasma. So we take his blood and we spin it and we inject it back, which the first time gave him some relief. But when we started using the activated plasma, things changed. After 3 times, we did another MRI and it healed his meniscus and the patellar tendon. Then he wanted to push further because he's very brave, and I told him about BPC and peptides. He did his own research and he came back and said, yes, we can do the BPC. So we did the BPC and the swelling went down. He's back to the gym and he's been active again. The MRI showed complete healing of the meniscus and the patellar tendon in the second MRI.
It's a painful injection during the procedure itself, but it helped change the range of motion as well as the pain levels during exercise, especially strenuous exercise. It's generally better, and specifically in terms of pain levels.
We're doing peptide treatment again. It's cutting edge. Peptides are small chain amino acids that's been used widely in fitness industry now, and for people looking for regenerative and anti-aging to promote healing. So after the PRP, we inject BPC 157 right into the tendons and the joint that will promote healing. We'll call all the healing and the growth factors from everywhere in the body to focus on this injury. So this is going to be his last treatment. He's going to go back to his activities. He's going to go back to playing squash, going to the gym, and standing for 12 hours for his shift as a pharmacist. All right, so are you ready?
I'm ready.
All right, let's get started. All right, so we're ready with the BPC 157, body protective compound 157. It's a peptide. We had it before. It hurt a little bit for 24 hours, and after that, you should be able to resume your activities as normal. So we're going to start with both knees. We're going to start with the right knee and then the left knee, which has a little bit more problems than you were suffering from it. You have to get to the right spot to inject. Once you get to the right spot, pretty much you can inject chocolate sauce if you want, right? But without getting to the right spot with the ultrasound guided, it's impossible to get a healing effect of any kind, even if you're injecting the right thing, right? And this patient is pretty active, like I said. He refused having steroids and cortisone. As I always say, try to avoid cortisone and steroids at all costs, as the cartilage degrades the bone and make it actually worse. And we're done. We'll see the patient in a couple of weeks, see how he's doing and the results, but he can go back to his activities, like I said, within 24 hours.